So you are interested in bariatric surgery. All right, well, let's get started with the basics. So first of all, if you have an Apple Health plan and bariatric surgery is a benefit, however, it requires you to have either diabetes or you need to have a weight-bearing joint replacement. That's like a knee or a hip, and the surgeon or the doctor has told you that you need this surgery, but they can't do the surgery until you lose, quite a bit of weight. So in those conditions, you can be approved for bariatric surgery. There are some other extreme rare diseases that also work or count, but one of them is called pseudotumor cerebri, and I've actually had a couple of patients with that, but they're pretty strict about this criteria. So you need to have one of these conditions along with your body mass index needs to be over 35 with one of these. Now, if you are a Medicare patient, then you are not required to have diabetes or needing the joint replacement. You just need the body mass index over 35, but some kind of what we call comorbid condition that goes with that. But it can be hypertension, sleep apnea, fatty liver, prediabetes, any number of conditions that are related to your weight. So that's a little bit easier. And then for private insurance, if you have the benefit, then your private insurance applies to that. So if you are Medicare or private insurance, actually the first thing that you want to do is just contact the Bariatric Surgery Center online or get their phone number and call and schedule a weight loss seminar. That is your first step. And from there, you meet with the surgeon and you get the surgeon's checklist of what you're going to do. Now, I will tell you that it is going to require you to see the nutritionist for at least 5 months in a row to prepare for that. But your first step is to go to the seminar. No referral, no application. Now, if you're Apple Health Insurance, we need to submit an application. And like I said, you need these conditions to do that. But if you have one of those conditions, then we can start the application. Now, if you're approved to move forward, it doesn't mean you get approved for surgery. You're approved for something called stage 2, where you have to do 6 months of visits and some other requirements in order to move on to the bariatric center, and then from there have another checklist of things to do, and then they will apply for the surgery authorization at the right time. So let me go back and tell you, if you are approved for this 6-month stage 2 process, you will need to see your PCP, your doctor, once a month for 6 months. You'll see the nutritionist twice a month for 6 months, so 12 total visits. You will need to keep a food journal. You will need to have what is called a psychosocial assessment with one of our licensed behavioral health consultants or one of our licensed social workers. And that is just a visit that you have with them that they have to go through a set of questions and looking for, concerning maybe eating behaviors or some other things that are involved in this application. It's a one-time thing, but it is required by your insurance company. You have to be non-smoking. So if you are smoking, you need to stop now. And ideally, you need to stop before we actually apply, because once we apply, you're going to have a period of time to quit smoking. And sometimes that's really difficult for folks. It might just be easier to work on quitting smoking now, then we apply, so you don't run into this deadline after, which can be more stressful. But I have found that patients who are motivated because they want the surgery actually are able to quit smoking for the first time, and a lot of them find that it's less difficult than they thought, but others are finding it very difficult. So that's kind of one of the tough ones, but I do encourage you to, if you are smoking and you quit smoking, please do not resume smoking after surgery, thinking, okay, I'll get the surgery and then I can go back to smoking. Please don't, because nicotine inhibits healing. Even if you have the surgery and you're free of nicotine and smoking, if you resume smoking after surgery, you have almost 100% chance of developing complications. So if you need to quit smoking for the surgery, please think of it as lifelong and don't resume after surgery. So once you complete the visits and you do your food journal, you have your psychosocial assessment. One thing I didn't mention is in the 6 months, you also have to lose 5% of your weight. So that 5% is based on the weight, your last weight that you had when we applied for you. So for instance, if you weigh 200 pounds, that 5% is 10 pounds. So in 6 months, you have to lose 10 pounds. You have to complete the visits and the weight loss and do the food journal, the psychosocial assessment, and be non-smoking throughout that whole period of time. And you must maintain your weight loss and non-smoking up until surgery. So that's what you can look forward to if you meet the criteria and you want us to apply. And we look forward to working with you for the next 6 months to help you meet those goals.